Les protecteurs du cadeau de la vie de Dieu presents the operating room techniques demonstration. The operating room is arranged to minimize the patient's risks for infections. Therefore, it is important for the surgical team to maintain the cleanliness and sterility before, during, and even after surgeries. What you'll be watching is a series of demonstrations according to the procedures done when entering the operating room. Enjoy!
Don surgical cap or bonnet. Remove watch. Put on goggles if necessary, and rolls the sleeves above the elbow level. Wear mask. Open the scrub brush to be ready for use. Turn on the water using the control level or foot panel and adjust it to a comfortable flow of running. Wet hands and arms. Keep elbows flexed to maintain hands higher than elbows. Use plastic nail stick to clean under nails and clean nails under running water. Lather hands with antimicrobial cleanser. Rub palm to palm. Rub hands right over left. Rub fingers interlaced. Perform rotational rubbing of thumb clasped in left palm. Perform rotational rubbing of the wrist. Perform procedure on both hands. Rinse hands thoroughly and maintain proper position of hand during the entire procedure. Wet hands from fingers to elbows. Remove the scrub brush from packaging. Apply antimicrobial liquid into brush. Scrub the nails of the right hand for 15 strokes. Scrub the nails of the left hand for 15 strokes. Scrub the sides of the fingers of the right hand for 5 strokes. Scrub the sides of the fingers of the left hand for 5 strokes. Scrub the palms of the right hand for 20 strokes. Scrub the palms of the left hand for 20 strokes. Scrub the dorsum of the right hand for 20 strokes. Scrub the dorsum of the left hand for 20 strokes. Scrub the distal third of the right hand for 10 strokes. Scrub the distal third of the left hand for 10 strokes. Scrub the middle third of the right hand for 10 strokes. Scrub the middle third of the left hand for 10 strokes. Scrub the proximal third of the right hand for 10 strokes. Scrub the proximal third of the left hand for 10 strokes. And perform the scrubbing motion with adequate friction.
Wash hands thoroughly.
Once in the operating room suite, hands and arms should be dried using a sterile towel and aseptic technique. You are now ready to don your gown and sterile gloves. Pick up the gown beneath the neckband at the armholes. Avoid touching the sterile field and the outer surface of the gown. Hold all the folded layers of the gown to avoid it from dangling and rubbing against the unsterile surface. Move away from the table while holding the gown from the body at arm's length. Allow the gown to unfold from the top going down. Ensure that the gown does not touch the floor or any unsterile object. Open the gown with the armholes facing south. Slide arms part away into the sleeves of the gown. Keep hands at shoulder level away from the body. Ask assistance from the circulating nurse. Open the inner sterile glove package with a hand covered by the sterile gown cuff. Pick up the first glove by the cuff. Start gloving the non-dominant hand first. Position the glove on the forearm with the cuff facing the hand. Glove the fingers towards the elbow. Place the glove's rolled cuff edge at the seam that connects the sleeve to the gown cuff. Grasp the bottom rolled cuff edge of the glove with the thumb and index finger. Grasp the uppermost edge of the glove's cuff with the opposite hand while holding the glove's cuff edge with one hand. Avoid exposing the bare fingers. Stretch the cuff of the glove over the hand while grasping the glove. Grasp both cuff and sleeve seam using the opposite sleeve covered hand.
Morning, sir. My name is Veronica Gigahata, sir. I am your nurse for today. May I ask your name, sir?
RV Parenias.
Sir, do you have allergies on iodine or seafood, sir?
No, ma'am.
So, sir, I will be performing skin preparation, sir. This is for you to prepare for the upcoming surgery, sir, and to prevent for any surgical site infection, sir. If I am done doing your skin prep, sir, please do not touch the area being prepped. Thank you, sir.
Yes, ma'am.
Inspect for any cuts and nicks in the skin. Gather needed materials and equipment at bedside.
Perform hand washing and provide privacy to the patient. Open skin prep set and arrange the materials and equipment properly. Pour betadine cleanser and solution to appropriate containers. Place cherry balls or gauze pads on the sterile set. Expose area to be prepped and approximate the area to be prepped by placing towels along edges. Ensure that towels cover the contaminated areas or objects. Pick the glove with the inner surface without touching the outer surface. Pick the second glove with the outer surface using the gloved hand. Perform the procedure aseptically. To start the initial skin preparation, paint the side using gauze with betadine cleanser. Apply adequate friction while painting the area. Observe margin of safety by painting area from incision site to periphery. Perform the procedure using circular technique. Discard the used gauze to receptacle without lowering the hands. Blot the prepped area to dry the cleanser on the skin. For the final skin preparation, paint the side using gauze with betadine solution. Apply adequate friction while painting the area, and observe margin of safety by painting the area from incision site to periphery. Perform procedure using circular technique and discard the used gauze to receptacle without lowering the hands. Remove draped towels without touching the prepped area and remove the used materials from the sterile field. Dispose used gloves properly and wash hands. Provide privacy to the patient by covering his or her lower extremities. Avoid touching the patient by hiding the gloved hand under the folded portion of the covering. Proceed to cover the chest area up to the patient's chin. Apply the first towel by hiding the gloved hand under the folded portion of the OR towel. Place the second OR towel by maintaining the principal, perpendicular to the first towel. Place the third OR towel while observing the same principle. Secure the OR towels using towel clips. Put the fourth OR towel while maintaining the principle. Secure the fourth OR towel using the towel clip. Check the proper position label of fenestrated drape and place the drape over incision site, ensuring correct placement corresponding to the label. Spread out the drape and handle the drape with gloved hands hidden under the folded portion.